I'm Dr. Muhammad Al Kashab, one of the co-chairs International Cardiogenic Shock Congress in Abu Dhabi. It's truly a privilege to welcome Dr. Rick Nishimura, one of the most influential clinician, educators, and master physiologists in modern cardiovascular medicine as a distinguished faculty for the first International Cardiogenic Shock Congress in Abu Dhabi. Dr. Nishimura is an Emeritus Professor of Medicine at the Mayo Clinic College of Medicine and Science and has spent more than 4 decades shaping how cardiovascular physiology, hemodynamics, and structural heart disease are taught, interpreted, and applied in clinical practice worldwide. Internationally, Dr. Nishimura is recognized as a master clinician with unparalleled expertise in invasive and non-invasive hemodynamics. Beyond his clinical mastery, Dr. Nishimura's legacy as an educator is extraordinary. He received Mayo Clinic's Outstanding Cardiovascular Teacher Award for more than 20 consecutive years, an achievement so remarkable that the award was permanently renamed in his honor. Welcome, Dr. Nishimura.
Thank you very much.
It's a pleasure having you here today. We would like to start with just a few questions. Can you give us a brief introduction about the topics you will be discussing at the upcoming Congress?
Yeah, so this is certainly a very timely, exciting meeting, and boy, I was talking with Sammy. The world has changed in how we deal with cardiogenic shock with all of our new devices and bridge to transplant and so on and so forth. But for myself, I find it a real privilege to be able to go over the basics, because you have to have this foundational knowledge to apply all of these new technologies. And I'll be talking about what is termed just a simple right heart catheterization, which will become more complex, as well as understanding ventricular function using pressure volume loops.
That's amazing. Basics are very important, and we're lucky to have you explain that to us. Let me shift to something different. Like, what do you think we're still missing in the current guidelines regarding the utilization of invasive hemodynamics?
Well, we're not missing it as much as just not using it like we should be. It's interesting that 40 years ago, we were always putting in right heart catheterizations. Anybody who was sick, then Doppler came in and supposedly gave us the hemodynamic information that we would need. But I think it's gone overboard. What we're finding is that it's not accurate enough in many patients, especially those in cardiogenic shock, to guide management. And we really should be doing the invasive hemodynamics earlier and earlier and earlier to understand what's going on in the guide therapy.
Yeah, that's great, everyone, and it's a pleasure to have Dr. Nishimura with us today. And many physicians in the field, right, they don't feel uncomfortable with the invasive hemodynamics in unstable patients, especially with shock population. And as an expert in the field, what advice you give to trainees and early career physicians to build the confidence in this area?
Yeah, well, it's actually an interesting question, because interpreting hemodynamics is really an art. And I liken it to the physical examination. The physical examination is an art which is dying out. But there's certainly kind of the masters of cardiology, the people who've been around for a while, who still remember and understand how to properly interpret things. And for the young people and the fellows, I would say, find yourself, a Sammy who's done this for years and years and years. Every complex case you take the trace, and we'll talk about not just the numbers, but the traces themselves, and go over them after each case, kind of reflect on what you learned from it and what you want to learn from it, and use that to train yourself for the future.
That's amazing. So moving to the next question, how do you see this conference as an opportunity to improve cardiogenic shock care, most importantly, globally?
Yeah, well, you've done a wonderful job of bringing in experts from all over and every different area that deals with cardiogenic shock. And I think just to have everybody together in one conference talking to each other, you'll be able to kind of form opinions and protocols about what should be done now, next steps, so on and so forth. So this is a unique Congress, and I'm just so delighted that you've put it together.
Yeah, that's great. And I'm also excited about hemodynamics workshop and always learning from you. And as we ring in the new year, right, ending 25 and starting 26 in a good shape and good education, what message would you like to leave with the shock team around the world coming to the region around that time?
This is kind of like what ST elevation myocardial infarction was like 20, 30 years ago. And we learned that the sooner you get to them, the better off they'll be. And I'm afraid that we've let people kind of dwindle down in the cardiogenic shock when we should be intervening earlier and earlier and earlier. So the message is early recognition, earlier intervention, and then get them to the centers that have the true multidisciplinary shock teams.
That's great. Looking forward to see you and everyone here in UAE in Abu Dhabi in January 2026. Thank you.
Okay, thank you very much.